D Bulmash, and I'm giving a little bit of a demonstration about my system called Torque Reset. This is Chelsea. She'll be accompanying me today. You're going to see much of my own work, and then you're going to see other work integrated into what I do today. Okay? But I'll do what I can to tell you when I'm doing my specific work, so you have a better understanding of what it is. Chelsea, how are you today?
I'm good, thank you.
Good, very good. So we did your lower extremities a moment ago.
Yeah.
Now, how would you like me to clear out your spine?
I would love you to.
Okay, good. So are you having any specific issues that I need to know about?
Not at the moment. I do have lower back pain typically, and tight mid back and tight upper neck.
Okay, so I want the viewing audience to know that at this point, we're going to be just demonstrating the corrective procedures. So we've done the history, we've done any needed neurologic work, orthopedic work, and I've worked with Chelsea before, so everything I'm going to do is going to be how to correct the problem. We clear? So I'm not going to demonstrate how to do proper orthopedic tests here. That's not what this is about. So let me show you something that's quite interesting here. Chelsea, are you having a particular area of your body that's just not working as well as you'd like it to right now?
I feel like a lot of my body's not working properly just biomechanically. So
okay, so is there an area of your spine that is giving you particular difficulty?
Probably around L5. I have like a little bit of a spondylo, like grade 1.
So I'm going to show you something. This is one way. There are many ways that I or that you could look at correcting this, right? So here's what we're going to do. Touch where it feels like it's not working, where you may be in pain, inflammation, and hold it.
Okay.
Now here's what we're going to do. I'm going to show you something. Ready?
Mm-hmm.
Chelsea, resist me. I love muscle testing. It's a tool. It's not a be-all, it's a tool, right? Gives you immediate information. Remove your hand. Hold. Still not strong. We need to correct some things in her body, but would you say that the first one was a whole lot weaker than the second?
Yes.
Yeah. Watch this. Touch where you're having difficulty. Now, I'm going to tap this into her central computer, her brain. 1, 2, 3. Now, watch this. Hold. So her arm is now a reflection of the biomechanical and neurologic distortion of, was it L5 that you were touching? Mm-hmm. May I turn you around this way?
Yeah.
Now, here's what we're going to do. We're through kinesiology, we're going to ask her body how she wants us, if you will, quote unquote, to enter her system to make corrections. Everybody understand? I'm going to start at the tailbone because an enormous amount of trouble with the spine starts in the tailbone and very few people address it. Why is that? Because it's the anchoring point of the protective layer known as the pia mater that supports and protects the spine and the spinal canal. So what are we going to do? We're going to test here. She's very weak. How are we going to know if she's weak? What to correct, or what the portal of entry will be, because she will suddenly become much stronger. I'm going to start on the tailbone, and here we go, hold. What do you notice?
Stronger.
How much stronger?
A lot stronger.
A lot stronger. Come right up here, Grace. I want you to see this, because I don't know of anybody else who does this. I am going to do a standing coccygeal adjustment. You can get much closer here. Here's her tailbone. I'm supporting her abdomen, right, because as I'm going to do this, I'm going to push her forward. You particularly want to stabilize someone if they have a bad low back injury, right? If somebody has a disc problem, this is a great move because you don't put a lot of pressure on the area that's highly inflamed or problematic. Going to come right here. Here's your tailbone. Listen very carefully. Now you just relax. I'm going to give her a moment to process. One of the reasons I do not have a high volume practice, for me, seeing 30 to 50 people a day is a lot of people. You want to give a moment in between adjustments because you're sending a huge flood of information to the brain to reset the nervous system and the mechanics. Now I'm going to step over here. Chelsea, how is this? Chelsea, how is this arm since we started with it?
Better.
It's not perfect,
no.
But would you say it's considerably stronger?
Yes.
Now, you might be thinking as you're viewing this, why is he checking her standing up? Because most of us stand up and we walk and we do various activities while we're in a standing position. This is very important because a person can test very differently standing or sitting than they can in a neutral position where the only force upon them is gravity holding them to the table, adherent to the table. So it's very, very important to get used to testing people in more than one way. You get a different set of information. Now, we're going to retest. I'm going to start at the tailbone and hold, very strong. We're going to go up, sacrum, very weak SI joints. Ooh, thoracolumbar junction. Now, I'm going to face you, Grace. Watch this. Turn, 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 turn. How am I going to do this? I'm going to do this. And by the way, some of this is intuition, right? A lot of people have difficulty adjusting her when she's on a table. I'm going to start working on her while she's in a different position. Give her brain different information, and I'm going to bet I can adjust her a whole lot easier in this position. So here I go, deep breath in, taking my chest, putting it in the curve of her low back, blow it out. Stabilize them. Are you okay? Mm-hmm. Why do we do that? Because we're decompressing segments. And sometimes when you do that, you need a moment for the body to regain itself and support them. So always stabilize them. How are you feeling?
Good.
Any problem with that?
No. I feel like I can breathe better.
You bet, because we released this. Now you can open your chest more. Now, hold. I don't typically muscle test this way, but I want you to be able to see it well. How does that feel?
Strong.
Strong. Start at the bottom again. Why? Because sometimes when you correct an area, you create further distortion elsewhere. So you'll always see me go back to here. Hold. SI joints still not showing up for correction yet. Boom. T2. Here's how we're going to do this. Interlace your fingers behind your head. Put your hands right over mine. Drop your head forward. Now, I'm not going to give you all the details in today's segment, but I'm going to do some interesting things that you may observe as I do them. Deep breath in, squeeze your elbows towards your nose.
Oh, that's good.
Now, there might be people watching this who think his technique wasn't very good. And I say that because sometimes people watch me do that and they'll say, you weren't balanced in your motion. No, I wasn't. Why? Why wasn't I balanced? Because she had a distortion that involved the muscles of the spine being much tighter on one side than the other. Much tighter on the left than on the right. So what I did is I imposed on T2 this kind of motion. So I had a torque component to take into account the tighter musculature on the left. That's why it didn't look like a unified balanced movement. So nobody, I don't need anybody saying that was poor form. That was exactly what I wanted. Now hold. What do you notice?
Strong.
I'm going to drop this one. I'm going to put this arm up here. Look at this. Hold. Here we go. Hold. Oh. Now all of a sudden, what shows up? L2. Now, I'm going to localize and I'm going to target a force on this, what we call subluxation, which means we have a misalignment and nerve interference coupled. So I'm going to apply force in different ways to see how it strengthens her. Look at this. On this side, it makes her much weaker. Oh, on this side, much stronger. So, are you okay if I put you in an anterior style adjustment?
Yeah, I've never had that one.
Oh, you're going to today.
Okay.
All right. So, what I'm going to do is I'm going to have you sit here on the tail edge.
Okay.
The tail edge facing this way here. Now, watch this. Grace, thank you so much. I'm going to have you come to that other side right here. Watch what I do here. We're going to cross nice and low. You're going to hug yourself tightly.
Okay.
Okay? You're going to keep your chin to your chest. You're going to let your knees roll up to your chest.
Okay.
I'm going to come down here, and I'm going to put L2 in the middle of my hand here. And I'm going to be doing little tricks that you'll learn on another day to act as a fulcrum to get this to release. Deep breath in.
Whoa, that was awesome.
Was that specific?
Yeah.
Did you feel how I torqued you to take into account the much tighter musculature in the lumbar spine.
Yeah.
Ready to walk around?
Mm-hmm. But it was really gentle.
It was very gentle and very specific. You should be breathing better now.
I am.
Now, come right over here, and I'm going to have you stand in front of Grace, who's videotaping. Hold here. Have you noticed I keep going back and forth to see if both arms are strong? Once again, sometimes you can do something that takes you 2 steps forward and 1 step back. I'm making sure that both of the testing arms remain strong, and that's beautiful. Would you say that's considerably stronger than it was? Now hold. Interesting, you see what I'm saying? Let's do this again. Look at this. Hold. Beautiful. So if I only tested this arm, I would think I was Magic Man. But look at this. Hold. Now my neurology friends would say you've overstimulated the brain. Maybe. Let's see if there's anything else we can do to restabilize it, reintegrate it. Coming at the bottom here. Oh. Hold. That's 6. Now, I'm going to correct this with drop, because with her distortion, I'm not going to go into a lot of that right now. I think it's going to be a much better choice. May I please have you lie face down?
Yes.
By the way, hold on. I want to do one more thing.
Oh.
One of the things you can do when you do drop work isn't just throw a person on the table. I'm being playful. Nobody throws people on tables. But I'm going to take her head into slight extension. What do you notice when I do that?
Feels better.
Yes. Much better.
Yeah.
What does that tell you? I should probably correct her with slight extension in my drop work. Watch this. To prove the point, let's put her in flexion. Hold. Did your body like that position?
Mm-mm.
Well, I don't think so. Here's a neutral position. Hold. Feel how nice right there? How that is?
Mm-hmm.
Now hold. Which position would you want to be adjusted in? So lie face down. We're going to put this so that she gets mild extension. Now, once again, I have many ways of doing adjustments. I could do it like this with one hand. I like to do it with 2 hands. Here's why. Because she also has a rotational component to this, right? Does that make sense?
Mm-hmm.
Now I'm going to get here, right here, beautiful. And what do you feel right there?
Stuck.
Really, really stuck. That doesn't feel bad, does it?
No, it's not.
So I want you to see this, Grace. So what we're going to do is we're going to slide in here where it's stuck. You see that? All the motion here? Can you see that, Grace?
Mm-hmm.
Nothing here. Watch this. Breathe in, gently bite down. You notice there's more force on the right. It's much easier to control that when you use both thumbs. Now, I don't care. You can do the old keg style where you come in like this. It doesn't matter. Whatever you're comfortable with. Once again, I'm not attached to how you do it as long as you get adequate results. Okay, let them process for a second. Most people get lightheaded from this type of adjusting. But I am going to take her out of extension. I am going to put her in a more neutral position. Now, you are welcome, Chelsea, when you feel it appropriate, when you're not lightheaded, and you feel like your body's come to a nice point in your processing of rest to sit up.
It does feel good just laying
Yeah,
here.
it does.
I don't feel lightheaded, but
It does feel very, very good. Her
Really
body is
relaxed.
taking a deep breath of ease.
yeah.
Yeah. Are you okay to stand?
Yes.
Okay, good. Thank you so much. Turn this way here. Now, let's test both. Remember? Both. Hold. That feels pretty strong to me.
Yes. Yeah.
Yeah. Hold. What do you think? We could leave her here, right? Or we could do some more advanced testing. If someone comes to you and says, I don't know, I'm fine when I'm walking around like this, then all of a sudden I turn my head to make a lane change and my system short circuits. What do? Anything like that happen to you?
I would just say I probably sleep on my side and
Yeah.
I wake up more tight, but not really any trouble when I turn my head.
Okay. Let's pretend that she does have trouble. What do? Here's what you do. I'm going to test her now. I'm going to test her now to make sure her nervous system can have good output for both upper extremities and have her balance at the same time. Now hold. Now spread your feet shoulder width apart. Now hold. Good. Let's have her do some interesting things here, okay?
Okay.
You're going to do what I tell you to do here with regard to your neck. Turn this way here and hold. Whoa!
You're pushing harder.
Yes, of course I am. Because that's always the, no, I know you are. But that's what patients will tell you. You're pushing harder.
It can't be.
Really? Am I? Turn your head. Pinky. Yes, of course I'm pushing harder. So that means we have a rotational issue that's creating a great deal of distortion. I'm going to have you sit on the tail edge of the table facing out the window here. This is really important because this is the kind of thing, if you always check people in a supine or a prone position, you don't necessarily know if you're catching all of these strange aberrations when a person's vertical in time and space. So what do? Let's put her head in this position and see how she responds. Hold. Oh, very strong. What if we put her in that same position over here? And hold. This is why you don't arbitrarily just adjust one side of the neck and the other. Because this way, if I adjust her neck this way, I'm going to overfire parts of the brain. This is the kind of thing that our friends who are chironeuros go crazy about. Because this, if I adjust this side when her head is in that direction, will worsen her big time. I promise you I'm going to never do this to her. She'll blow out, and I won't know why. So we're going to have you turn this way here, and if there's even a question, you can palpate, of course, and find out where she's locked up. And when you've done thousands of people, she's locked up right here at 4, C4. Now, what if I'm not sure? What if, I'm thinking, boy, she's pretty distorted at C3, C4, and C5. What do? Test. We're at the level of 7 here. No change. 6 here. 5 here. 4 here. 3 here. Which is strongest?
3.
3?
6.
I'm going to go 4. Here's 7. 6, 5, 4,
Yeah.
3.
Okay.
Now, what if we're not exactly sure about the angle of rotation or the elevation of the head? Let's put it right here. Say to the patient, Chelsea, keep your head right there, okay? And hold. Hold. I don't know if I can get it much stronger than that. You agree?
Mm-hmm.
Relax. Deep breath in. Let it go. Just relax. Now, did it look like there was much excursion, or did it look like there was just an impulse?
Felt like just an impulse.
Yeah. Don't ever let anybody do this craziness, ever. That's crazy. I've had patients come in who had torn ligaments from somebody doing this. You are very specific. Very specific. Chelsea, hold. Look straight ahead and hold. Extend your head back and hold. Extend your head forward and hold. Now, turn towards this wall and hold. Turn towards this wall and hold. Now, if you want to be really thorough, if you have a patient who's just really struggling, let's have you do that here when you're fully standing here and you're bearing the whole weight. Now, I'm going to give you a moment to let her body, you see, she might be getting enough support here that everything is fine. So we even have different levels to challenge the body. She was sitting, she's getting some support from the table. Now she's standing. Next level, bearing weight, bearing resistance on her structure. Let's see how she does. Hold. Follow me. Are we done? Maybe. We could say, how do you feel?
I feel great.
You feel great?
I do.
Walk around a little bit. Let's have them process. Let's have them move around. Now we add motion. Next step. Once again, you don't have to do this level of work with every patient. But if somebody has a history of having some real strange things, particularly an athlete, right, who's going to be doing, whether it be a lot of lifting, jumping, running, being hit, but just because we can, let's check at another level. Let's see if you jump up and down. Right, this puts a whole different level of force through the body. Come right here. And hold. Pretty good. We good?
I think so.
Okay, maybe. Now you're going to arch back and hold. Forward. Now forward and, oh, no, stay right there. Flex forward, lean forward, rotate and hold. Hold. Forward, rotate. Look at this.
Yeah.
See, this is what I mean. You can go as far down the rabbit hole as you want. Let's correct it. Just because I won't sleep tonight if I don't correct it. Okay, bend forward, rotate. By the way, you would never do this with somebody who's so compromised they couldn't, somebody with a severe, like a disc problem or something like that. So we're going to check. Oh, this is going to be interesting. Face down, please. So she's got a rotational distortion of her fifth lumbar. Now, I'm going to do something, I may not be able to do it. It's called a Fassett imprecation mobilization. Going to come down here on 5. Now she's too tight. Okay, so I was going to do this kind of move here. All right, spinous process does not move from right to left. Now that looks ridiculous, I know. When I used to do that, people would watch me and go, okay, what was that? Here's the thing, when you're not imposing yourself on a person or a person's field so that you're threatening, there's no resistance, except the inherent resistance in the subluxation or the fixation of the joint. May I have you stand now? Now, bend forward and hold. Oh, all the way forward. Okay, good. Now rotate this way while you're bending forward and hold. Rotate. Now, lean back, rotate, and hold. And hold. What do you think of that? That is a very good place to stop. Thank you for watching my video.